Human metapneumovirus. So what is this HMPV? It was discovered in China since 2001 and in India we have it since 2010. It belongs to a large group of virus with the symptoms like common cold, flu and respiratory sickness. Like coronavirus, RSV and also influenza virus, HMPV is a virus causing respiratory illness which has an RNA genome. So what are the symptoms if you are infected with HMPV? Children who have a childhood obesity and elderly patients and patients with asthma, influenza and bronchitis are more vulnerable to get this HMPV. So almost at the age of the 5, everyone is affected with HMPV. So do we have any precautions or any vaccinations or drugs for this? Unfortunately, no. This spreads widely in the air and it is highly contagious also. So these type of illness can be protected only by keeping ourselves in a cautious way. Like how we followed it for the coronavirus, hand hygiene, wearing a face mask and being away from the infected person is the only remedy for this. So why if it is in India since 2001, why it is on the news now? Most of the respiratory illness causing virus, especially this HMPV, spreads widely in a colder weather. And when it is put under the pressure and it is stable when we are staying in the indoors. Before even coronavirus, there were a lot of outbreaks of the respiratory illness which put the hospitals under the pressure, especially in the winter. By the time, we were not much cared about the virus causing the respiratory illness. But since the interest to learn more about the illness is among ourselves, we come to know about the new type of the virus. But to our surprise, still we have very little knowledge about this disease causing virus. So is that going to be a pandemic? It looks extremely unlikely. So in contrast to the COVID-19, this has been there in India for decades now. So only precaution is to be away or to keep our immunity in a strong way. If we see it in an Ayurvedic perspective, we can follow Dinacharya, which includes Nasya, to keep our nasal passage in a clean way and also to keep an oral health, especially practicing Gandusha, Kavalagraha like gargling with gingerly oil, Trifala Kashayam and doing Nasyam with Anutailam is the best remedial measure to keep ourselves away from this type of respiratory illness. Thank you.